Thank you. When you turn on the TV and surf the channels, it's invariably that you'll see a story about death and disaster. It'd be easy to get a sense of hopelessness in the face of this, yet every day people approach life with a sense of hope. As a neurosurgeon, I've been fortunate enough to learn from my patients what it means to hold and cradle hope, especially when the odds are against you. I specialise in the treatment of children and adults with brain tumours. Brain tumours can affect those parts of the brain that make us who we are. They can steal our ability to walk, to speak, to see, and in time they can even steal our consciousness. Unfortunately, 50% of all brain tumours are malignant. That's brain cancer. And for me, brain cancer is the worst of all the cancers. It is totally indiscriminate as to whom it affects. Symptoms can come on suddenly. They can be devastating. Many people who are diagnosed with brain cancer are forced to face the fate that they never thought was possible, that their lives are measured in months and weeks, and that their hopes and dreams may never be achieved. Sometimes they're told to go home and make arrangements for end of life, and it's at this time that patients display amazing courage.
So this is my family, the Stewart family. There are 3 grandchildren, 4 of us kids. Then there's Mum and Dad, Harry and Louise. They are still in love and have been married for 38 years. If you were to trawl through their Facebook pages, you would see a couple that love their grandkids, who travel a lot and seem to have kids that genuinely love hanging out with them. Before I continue, I want to be clear. My family are not perfect, but I think we're normal. To tell this story, I need to be a terrible aunt and single out my niece Maddie. Here she is. She was born in October last year, and she is my sister's first child. She quickly joined the ranks of the dynamic duo of my sister and my mum, whom are addictive shoppers. I mean addictive. They do things like withdraw cash from the ATM so their husbands don't realise they are spending so much money on clothes. They get parcels of clothes purchased online sent to each other's house so that they can secretly collect them when their husbands don't see. This is Maddie and Nanny out on a shopping expedition in Sydney when she was 3 months old. This is them 3 days later in John Hunter Hospital in Newcastle. Now, as you can see, my mum is a well lady. She lives a fit and healthy life in Newcastle. She has never smoked and has this very strange ability to only ever have 1 glass of red wine, then stop. Even worse, she's one of those people that can have 1 Tim Tam and put the rest of the packet in the cupboard to have another one in a few days' time. This story is about my mum, Louise. The best way to explain is to talk about broccoli. Yep, broccoli. Mum does her shopping every Wednesday at Market Town in Newcastle. My dad retells it that Mum walked in to see him in the study one Wednesday morning and she was in tears. She had been trying to do the shopping list and she couldn't remember the name of the green vegetable in her hand. Something was not right. The worst moment of my life occurred 1 day later when I was standing in the hallway of the hospital with my father. A doctor was telling us that Mum had 4 brain tumours on the left side of her brain. One of them was the size of a tennis ball, which was affecting her speech. 24 hours later, my mum was getting wheeled away for brain surgery. A neurosurgeon was willing to remove the largest tumour that was causing the issues with Mum's speech. We were told there was a 1 in 100 chance that she would die in surgery and she might not be able to speak very well afterwards due to the location of the tumour. The 3 other small tumours were inoperable. This journey has taught me how strong and brave my mum really is. She came through the surgery well, saying, I'm fine, just as she was being wheeled out of recovery. We were so relieved. Mum was told to go home, rest and make appointments for chemo and radiation. My sister Emma had been on Google, something I refused to do. She was distraught and she was constantly crying. Mum had a grade 4 glioblastoma multiforme tumour, a GBM, the worst type of brain tumour. She was adamant that Mum needed to see Dr. Charlie Teo in Sydney. She found out that he generally didn't take new patients. He was so busy and now spends a lot of his time teaching and working overseas. I knew who he was, and I knew that he was a surgeon. It turns out my sister's tenacity and determination was crucial for Mum's life. We were not told, but Mum had been sent home to die. The surgery on the largest tumour was palliative action to reduce the swelling in her brain. This is where Maddie comes into the picture. My sister contacted Dr. Teo's office and sent all Mum's scans and information to him the moment we got a copy from the hospital. She wrote it on behalf of her daughter Maddie. It said, "Please help my nanny." It got us a consultation. After big cuddles with Maddie, Dr. Teo told my mum her prognosis was anywhere from 1 week to a maximum of 6 months to live. He said, "This is not good, Louise." A crushing blow. We knew the diagnosis was not great, but it was never outlined specifically like that to us by her previous doctors. He said he could give her more time and attempt to remove all 4 of her tumours. He said she would probably not be able to speak at all after the surgery, maybe yes and no after a few days. Otherwise, he listed all the other risks, and then he said with a smile to my mum, "But I won't let that happen to you, Louise." Mum agreed to it, and we all went to Sydney a few days later for her to have her second brain surgery in 3 weeks. This surgery was much more radical. It went for 6 hours with 2 incisions made. We were at the hospital from 6 a.m. till 10 p.m. All of us kids, Dad and Maddie, just waiting and worried. Dr. Teo was able to remove 95% of the tumours. In fact, there was no physical tumours left visible on her MRI post-surgery. Mum spent 24 hours in intensive care and had a few words at her disposal, but was otherwise very confused and agitated. Every single thing she spoke about was called that one or upstairs. She could not say our names and also seemed strangely lacking emotions. She was able to come home after 3 days, but the confusion and aphasia continued for several weeks. It's difficult not to be able to call your mum anymore on the telephone, and when you do talk to her, she can't say "I love you" anymore. Other side effects of the surgery have been poor sleep and a temporary palsy in the left side of her face. Her vision has also deteriorated. It got to the point where she could not see at all. All these symptoms are common for brain cancer sufferers. The thing is, from the moment that you are diagnosed, your life will never ever be what it was before. These issues cause setbacks and delays. However, Mum has since commenced daily radiation and chemotherapy out of Gosford Cancer Clinic under the care of the best neuro-oncologists in New South Wales. She has also recommenced shopping with my sister and Maddie again, and now tells us every chance she gets that she loves us so much. The charity I am advocating for is the Cure Brain Cancer Foundation. They are committed to achieving a 50% 5-year survival rate by 2023. Committed to finding successful treatments and maybe a cure. We as the human race are on the cusp of this. Science and mapping of the human genome is getting us close. We are not there yet, and we need more funding. Rates of brain cancer are increasing, particularly in children who have even less treatment options than adults. We must now fight for a cure. I want to know that the next person in this room or watching this that is affected by this insidious disease has more hope and more chance of life.
The world thought that it was impossible to climb Mount Everest, but in 1953, a very dashing, handsome young New Zealand mountaineer had the gall to believe he could climb Mount Everest, and he did. He conquered it in 1953. His name was Sir Edmund Hillary. Of course, I'd like to think that I was the Sir Edmund Hillary of neurosurgery, but I'm not. The Sir Edmund Hillary of neurosurgery is the patient, and it's the patient's relatives, or the relatives of the parents of a child with a terminal illness. They're the ones with the vision, the hope, and the courage to conquer Mount Everest. Patients teach us that this is not our journey, this is their journey. Hope is the essential ingredient in the essence of life. We all need hope. When we wake up in the morning, we hope that we're going to live to see the next day. We all hope that the world one day will be a world without war, without animal cruelty, without poverty. As doctors caring for patients and families who've been given the diagnosis of a terminal illness but who remain hopeful, our job is to respect and nurture that hope, not shatter it. False hope? There's no such thing. Thank you.